The greatest wealth is health, and Kenya's investment to the sector in recent budgets has ranged between 25 and 35 billion shillings. But experts now say the health status of Kenyans must be a priority. This week, the release of the 2008-2009 Kenya Demographic and Health Survey report became a measure of how the sector is faring.
The Kenya Demographic and Health Survey, it means it's really looking at the population and the behavior of population variables and also the health variables, which is really also related to the population. This is a report that is released every 5 years. It's done every 5 years. It's a survey that is carried out. This particular one covered 10,000 families, households rather.
It focused to provide information to help in monitoring and evaluating health and population situations in Kenya on fertility levels, nutritional status of women and children, childhood and maternal mortality, HIV/AIDS, among other health issues.
I think one of the positive things that has come out of the survey is that our infant mortality and our child mortality have reduced significantly. And also other health indicators have improved significantly, showing that there has been some impact with regard to the programs that we've been implementing.
A major focal point was exploring ways of making the country prosperous by improving health standards to mothers and children.
The indicator we are seeing, I think, a reflection of a change of support to the communities, where we are getting services now being made available, and possibly that is resulting in access to care, reduction of mortality, reduction of maternal mortality, child mortality, infant mortality. But more so it also guides in terms of looking at how best governments, ministries, stakeholders can utilize information to plan for resources.
Data and statistics on health is useful in implementing future plans and also in guiding, planning and monitoring the status of health in the country.
Our involvement as UNICEF has been primarily to support data collection in the northeastern province. As you can imagine, the northeastern province is difficult terrain. We have scattered households, so it makes it a bit more difficult in areas like that to collect information. So our support was to ensure that households in that area were covered in this DHS, and our support towards northeastern province data collection has been happening since the last DHS.
Currently, 4.8 million children in sub-Saharan Africa die before the age of 5 years. 11 million child deaths every year are attributed to 6 causes: diarrhea, malaria, neonatal infections, pneumonia, preterm delivery, or lack of oxygen at birth. Millions of Africans are infected by malaria every year, and over 1 million children die of the disease. This week also saw pivotal phase 3, a new malaria vaccine launched in 7 African countries.
With a malaria vaccine, we possibly will be able to eliminate malaria in the communities. The problem will still remains access of the vaccine, but more so not just access, but also the efficacy in terms of will it literally result in complete protection against the malaria parasite.
Family planning used by married women went up to 46%. Delivery care requirements increased from 40% in 2003 to 43% this year, and vaccination of children between 12 to 23 months went up at 77%.
What you have seen is that it's a change, I think, countrywide, where you can see families and communities have changed the way they normally were perceiving life and family size. So most communities have changed towards accepting family planning. They have also changed towards the birth spacing level.
Kenya has more advantage to other East and African countries in healthcare systems, citing its good infrastructure and increase in private healthcare in the country.
We compare favorably well with the other East African countries. But I think what is more important in this report is the improvements that we have seen in almost all the, the survey areas. There have been improvements compared to 2003. 2003 we had certain results, but now there have been very, very, very significant improvements, like child mortality rates have come down significantly.
Given Kenya's economic and political circumstances, the future of its healthcare system is bright. Now, what remains is to see how the information gathered from the survey is going to be used in implementing the Millennium Development Goals.
There is still a lot of work to be done. We have the MDG targets that we have to achieve by 2015. We are making our way there towards achieving those goals, but we use this information to inform on what gaps are still existing.
The interventions we have done, like malaria control, mosquito nets, application of mosquito nets, education, family planning services, among others, they are working. And so it's really perhaps to scale up and to go back and see where the data indicates that improvements are not significant, to find out what is happening and really go back and try to improve. And to sustain means that we must sustain the efforts that we have seen.